In the field of medicine, determining the appropriate dosage of a drug is crucial for achieving therapeutic effects while minimizing the risk of adverse reactions. Two key concepts related to drug dosing are maintenance dose and loading dose. Understanding these concepts is essential for healthcare professionals to optimize patient outcomes and ensure safe and effective medication administration. This video aims to elucidate the definitions, purposes, and considerations associated with maintenance dose and loading dose. Maintenance dose. The maintenance dose refers to the dosage required to maintain a steady concentration of a drug within the therapeutic range in the body. After the administration of a loading dose, the maintenance dose is subsequently employed to sustain the desired therapeutic effect. The specific maintenance dose varies depending on factors such as the patient's age, weight, organ function, drug interactions, and the desired therapeutic outcome. The primary objective of a maintenance dose is to keep the drug concentration within the therapeutic window, where it can exert the desired therapeutic effect while avoiding toxicity or suboptimal efficacy. Achieving this balance is crucial to maximize the benefits of medication while minimizing the risk of adverse reactions. Maintenance doses are typically prescribed at regular intervals, such as once daily or multiple times a day, based on the pharmacokinetics and pharmacodynamics of the drug. Factors to consider when determining the maintenance dose include the drug's half-life, bioavailability, clearance rate, and the patient's individual characteristics. Renal or hepatic impairment, age-related changes in drug metabolism, and drug interactions can affect the clearance rate, which may necessitate adjusting the maintenance dose accordingly. Loading dose. In certain clinical scenarios, the desired therapeutic effect of a drug must be achieved rapidly. This is where a loading dose comes into play. A loading dose refers to a higher initial dose of a medication administered to rapidly attain the desired drug concentration in the body. By rapidly reaching the therapeutic range, a loading dose allows the drug to exert its full therapeutic effect promptly. The purpose of a loading dose is to achieve a therapeutic drug concentration more quickly than with a maintenance dose alone. This is particularly important when immediate action is required, such as in acute conditions, severe infections, or in critical care settings. Once the loading dose has been administered, subsequent maintenance doses are then prescribed to maintain the desired therapeutic effect. Loading doses are especially useful for drugs with a prolonged half-life or drugs that require a gradual accumulation to reach therapeutic concentrations. By providing an initial higher dose, the loading dose helps expedite the process of achieving the desired therapeutic effect while avoiding delays associated with waiting for the drug to accumulate gradually. Relationship to steady state. The steady state is the point at which the rate of drug administration equals the rate of drug elimination or metabolism in the body. It is achieved when the drug concentration remains relatively constant over time. The steady state is crucial for optimal drug therapy as it ensures consistent therapeutic effects while minimizing the risk of toxicity. To reach a steady state, both the maintenance dose and the loading dose play vital roles. Initially, the loading dose is used to rapidly establish therapeutic drug concentrations, often bypassing the need to wait for the drug to accumulate slowly over time. This loading dose brings the drug concentration into the desired therapeutic range more quickly, allowing for a prompt response to treatment. The number of half-lives required to reach steady state depends on the specific drug and its pharmacokinetic properties. However, as a general guideline, it takes approximately 4 to 5 half-lives to reach steady-state concentrations of a drug. To understand why it takes multiple half-lives to achieve a steady state, we need to consider the concept of drug accumulation. During each half-life, half of the drug is eliminated from the body, while the remaining half remains. With each subsequent half-life, the drug concentration decreases by half again. Therefore, it takes several cycles of elimination and administration to reach a point where the drug accumulation and elimination balance each other out, leading to a steady-state concentration. The number of half-lives required to reach steady state remains the same regardless of whether a loading dose is used or only maintenance doses are administered. The loading dose helps to rapidly achieve therapeutic drug concentrations, but it does not affect the time it takes to reach steady state. The purpose of a loading dose is to quickly bring the drug concentration to the desired therapeutic range, especially when immediate therapeutic effects are necessary or when a drug has a long half-life. By providing a higher initial dose, the loading dose compensates for the time it would take for the drug to accumulate slowly over multiple half-lives. However, once the loading dose has been administered and therapeutic concentrations have been achieved, subsequent maintenance doses are required to sustain the drug concentration within the therapeutic range. The maintenance doses are adjusted based on the drug's half-life and the desired steady-state concentration. To estimate the time required to reach steady state, regardless of whether a loading dose is used or not, the general guideline of 4 to 5 half-lives is still applicable. This means that after the loading dose, it would still take approximately 4 to 5 half-lives of the drug to reach a steady state where the rate of drug administration equals the rate of drug elimination or metabolism. In summary, the use of a loading dose may help to rapidly achieve therapeutic drug concentrations, but it does not impact the number of half-lives required to reach steady state. Conclusion: understanding the concepts of maintenance dose, loading dose, and their relationship to steady state is vital for healthcare professionals in optimizing medication administration. The maintenance dose ensures the sustained therapeutic effect of a drug, while the loading dose rapidly achieves the desired drug concentration. While the loading dose expedites the process, it does not alter the number of half-lives required to reach steady state. Steady state is achieved when the rate of drug administration equals the rate of elimination, leading to a constant drug concentration within the therapeutic range. Regardless of whether a loading dose is used or only maintenance doses are administered, it generally takes approximately 4 to 5 half-lives to reach steady state. The knowledge and application of these concepts enable healthcare professionals to provide safe and effective drug therapy, optimizing patient outcomes and minimizing the risk of adverse reactions. Healthcare professionals must consider various factors when determining both maintenance and loading doses, including patient characteristics, pharmacokinetics, pharmacodynamics, and the desired therapeutic outcome. Accurate dosage calculations, careful monitoring, and periodic dose adjustments are crucial to achieving optimal therapeutic benefits while minimizing the risk of adverse effects. By understanding and applying these concepts, healthcare providers can effectively administer medications and improve patient care. Thank you for watching, and be sure to talk to your healthcare provider if you have any questions or concerns about your medications and any health conditions you may have. Disclaimer: the information presented in this video is for educational and informational purposes only. It is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified healthcare provider with any questions you may have regarding a medical condition. Never disregard professional medical advice or delay in seeking it because of something you have heard or seen in this video. We would like to express our gratitude to our sponsor, First Cup Coffee, the original seed, for making this video possible. Shop firstcupcoffeeusa.com. First Cup Coffee, the original seed, is dedicated to providing high-quality coffee that fuels your studies and work with a rich and invigorating taste. We appreciate their support in bringing you valuable, free educational content. Remember to visit firstcupcoffeeusa.com for your daily dose of exceptional coffee. That's a wrap for today's lesson on loading dose, maintenance dose, and steady state. I hope you found this video informative and helpful. If you have any questions or topics you'd like us to cover, let us know in the comments below. Don't forget to like and subscribe to our channel for more educational content. Take care, keep studying, and I'll catch you in the next video. Bye.